Hello, everyone. Welcome back to another session of A Day with your fertility specialist. I am Joanna Damina, your host for today. We're sorry about the delays, but thank you for sticking with us and thank you for joining us again today. We really do appreciate every engagement that you click on this video, you like, and you share. Today, we're going to pick up where we left off last time on Wednesday, talking about sickle cell genotype and fertility. We spoke about some preventions last time. So today we're going to focus a little more on the fertility aspect. And joining us today again, we have Dr. Ken. Welcome, sir. Lovely to have you. If you're joining us for the first time, Dr. Ken is a consultant gynecologist, an IVF specialist, or a fertility specialist generally, and also a minimal access surgeon. So he's gonna have a lot of insights for us today, I'm hoping. Okay.
Hopefully.
Yeah. So last time we discussed about a lot of things. Okay. We went, very long. So today we're just going to wrap up on the topic of sickle cell, and we'll be focusing on fertility. We have some questions around that.
Okay.
People want to know how fertility or how sickle cell disease can affect fertility in both men and women. I know last time we touched on that a little bit, but is there anything more we can get on that topic?
Yeah. Thanks by the way, and apologies for the
Yeah.
delay in broadcasting.
Sorry about that.
You know, sickle cell definitely affect fertility. And when you're talking about fertility, you're not just looking at conception, looking at the process of conception,
Yeah.
pregnancy itself, and the delivery process. For a woman, the delivery process is actually where we are all worried about.
Mm,
Yeah, because she's going to towards delivery with more or less a very low level of blood,
yeah.
because the problem is usually uh, reduced pack cell volume.
Mhm.
And for the layman, I would say the blood, the
The
blood
blood in
count,
yeah.
the blood volume or something.
Mm,
And then if you're going to have an operative delivery, for instance, uh, if it's bloody, it complicates the operative delivery,
yeah.
and so you need the experts to deliver them
Mm,
the fastest, the most accurate,
hmm.
you know, and the most careful.
Of course.
And then whatever quantity of blood is lost in the process of delivery should be uh, returned
Yeah.
to the body. That's in the
Yeah.
form of transfusion. So because it's drop by drop transfusion of blood. I mean, the equal volume of blood that was lost should be transfused. Otherwise, she can go into failure,
Mm-hmm.
anemic heart failure, for instance.
Oh,
Just during the process or after
oh,
delivery, and the
delivery.
complications that go with that.
Mm,
Breastfeeding is stressful.
mm-hmm.
If the volume is not very good, breastfeeding may also be compromised because she needs
Okay.
energy
Yeah.
to breastfeed. Blood gives energy
Mm-hmm.
because without adequate volume of blood, there's weakness,
Yeah.
poor wound healing.
I mean, considering they already have uh, an issue, let me say, like, that sickling you talked, so if there's blood loss, that means even the quality of the blood that they have, like the pack cell volume, like you
Mhm.
said, is already at a disadvantage. So when there's blood loss, it's even worse, right?
Exactly.
Oh,
And
okay.
because of the low level of blood that they may
Mm-hmm.
have problem with growth of the baby
Oh,
when
interesting.
the baby is still in the uterus.
Hmm.
Yeah, because if they are anemic during pregnancy, it's high chance to have a what we call a intrauterine growth restriction.
Okay.
The baby may not grow physically to its potential
Hmm.
when inside the uterus.
Hmm.
So you see, whichever way you look at it, fertility is just not very smooth, not very straightforward. But yeah, a good number of them will deliver without problems.
Problems, yeah.
Okay, and if should they decide to go through labor, you must ensure that the pain process of labor is being taken care of,
Yeah, it's quite
good
minimized.
analgesic during
Mm-hmm.
labor,
Mm-hmm.
so they don't they're not tipped into crisis,
Crisis, yeah.
vessel occlusive crisis, or whatever kind of crisis they are
Mm.
predisposed to. So for the frank sickle cell people, fertility potential, even conception, may actually be a problem depending on how healthy they were. I mean, in their
Prior.
early life, the frequency of crisis,
Okay.
the frequency of anemia,
Mm-hmm.
and all of that. So it could affect the process of ovulation,
Okay.
process of even conception,
Mm.
and all of that. Because you see, because of the level of crisis that some of them may have, the organs of reproduction, for instance, call it the testicles
Mm-hmm.
or the ovaries.
Yeah.
Sometimes they are supplied by some blood vessels. They are supplied by blood vessels.
Okay.
Those
Yes.
blood vessels may have problems
Mm.
with allowing blood flow through them.
Okay.
Yeah, depending on the frequency of crisis. And when blood doesn't flow adequately to ovaries or the testicles, for instance, the quality of sperms, quality of eggs, volume of
Everything is
sperms, and all of
compromised.
that is going to be compromised. So
Mm.
that's to say that the fertility potential may be reduced.
Mm. Okay.
So those are all the things. So whichever way you look at it, there's just a problem somewhere.
Mm-hmm.
Yeah, just
Yeah.
somewhere.
Oh,
Yeah,
if
somewhere there's
it's
just a
not
problem.
prior to conception,
Oh
it's during
yeah.
conception or after
Hmm.
conception,
Exactly.
delivery and things like that. So there's always one thing or another. But are there treatments like treatments for sickle cell disease? Does it really affect their fertility? Does that also have anything in play?
No, the treatment, well, look at this region, for instance. When you're talking about the treatment, usually you're preventing
Crisis,
crisis,
yeah.
you know, ensuring adequate blood levels,
Mm-hmm.
preventing malaria. And that's the best treatment they get, just to
Yeah.
prevent the crisis. So this particular kind of medication doesn't affect fertility.
Okay.
If for anything, it encourages or improve on their
Mm-hmm.
fertility. Now, if you look at some other kinds of treatment, for instance, let's say they're going to have some invasive procedures like a uh, bone marrow transplant,
Transplant,
for
yeah.
instance. Usually, after bone marrow transplant, they may be placed on some immunosuppressive medications.
Oh, okay.
So, immunosuppressive medications or even cytotoxic medications can suppress fertility.
Hmm.
Exactly.
Wow.
Yes, can suppress fertility depending on the kind of immunosuppressive medication. But
Mm.
at this point, you're not looking at fertility; you're looking at survival. So
Exactly.
survival
Yeah.
is paramount here, and
Mm-hmm.
it's of more importance than fertility.
Fertility, yeah.
So those medications could suppress fertility or
Mm.
could compromise fertility.
Yeah.
So
But that's not very common in this region,
no,
is it?
yeah, no, bone marrow transplant. It's available in this region.
Mm-hmm.
Just 2 weeks ago, I saw a little baby who has
Oh.
had a bone marrow transplant and has
Mm.
improved significantly
Yeah.
in her outlook to life.
Oh, that's
You could see the
lovely.
energy
Yeah.
returning. You see the joy on her face.
Mm.
The frequency of crises had tremendously reduced and all of that.
Mm.
And kids don't lie. If they're happy, they're happy.
True.
If they're sad, they're sad. And
Yeah.
for once, I saw a young child, being pretty happy with life.
Lively.
So bone marrow transplant is available in this region.
Mm-hmm.
And just like somebody asked previously whether CRISPR treatment compromise fertility, no, it doesn't compromise fertility
Yeah.
at all. It
Okay.
doesn't compromise. If for anything, CRISPR treatment may make fertility better
Yeah.
because you're cured of your sickle cell.
Mm-hmm.
That is
There's.
the only cure for sickle cell right
Mm-hmm.
now. You're cured of it, and so you lead a normal life.
Mm-hmm.
So fertility will, depending on the age at which the CRISPR treatments are
True.
administered,
Mm.
fertility may,
Yeah.
yeah. So it doesn't.
I mean, not to say that, like you said before, when there's the sickle cell crisis and then there's the treatments like the transplant,
Mhm.
that's more important at that moment than, the fertility prospects because you're
Exactly.
trying to save this person's life.
Exactly.
But, you know, if, let's say, they've gone through this whole process, they've managed sickle cell their whole lives and they're looking to conceive, to have a child,
Mhm.
what fertility or what assisted reproductive treatments or technologies would you suggest or think of to basically improve the outcome of conception for them or delivery for a sickle cell patient?
Okay, so now I think I'm a bit confused about your question.
Okay.
So, but I want to approach it looking at all the prospects of sickle cell
Okay.
from the AS
Mm-hmm.
and then to the C class themselves. Those
Okay.
who are SS, sickle cell
Please
anemic
do. Yes,
patients.
please do.
For the sickle cell anemic patient, seriously as an obstetrician, Yeah, I this is me now, not what is written in the books. I don't like them to get pregnant.
Hmm.
To be candid with you, I don't like an SS person getting pregnant.
Okay.
Yes, the whole world may not agree with this, but the risk getting pregnant and going through pregnant is just too much,
Hmm.
and if you get to the hospital and are okay,
Yeah.
but there are so many more in the society that don't have privilege of getting advanced obstetric care,
True.
and those ones have a lot of things happening with them and are not documented. They are just not part of the statistics we're talking about.
Mm-hmm.
The few we see, as in sickle cell ladies getting pregnant, we obstetricians were worried. You know, everybody monitoring them is worried.
Yeah.
The prospect, all of that, the prospect of being healthy and having healthy babies is compromised
Mm-hmm.
to an extent.
Mm-hmm.
You know, it's just for the risks that I don't like
Like
them
kids,
getting
yeah, just in
pregnant.
your
But of
experience
course,
and
it's not the way I feel.
mm-hmm.
You know, they want to be
Oh,
pregnant.
of course. Yeah.
They want to be pregnant. So
Mm-hmm.
the best we can do for them is to support them and give them the best care. But I don't just like the risk. That is me. I don't like the risk.
Yeah,
You know,
understandable.
like the risk. The fertility prospect is not very great.
Mm-hmm.
But I don't like the risk everywhere. I've seen some who just escape by the whiskers,
Hmm.
even in the best of hands, in the best of centers.
Yeah.
You know,
It's quite a dicey
yeah, it
situation,
is. It
talking
is.
about everything
So that's for
involved.
a woman who is just SS.
Mm-hmm.
And you know what? I've seen SS guys planning to get married.
You mean both partners being
The woman
SS?
is SS
Mm-hmm.
and the guy is SS. So I asked him, how do you intend to get her pregnant? Yeah, how do you intend to
I
get
mean,
her
at this point, you're
pregnant?
definitely going to conceive a child that is
Exactly.
an
How do you
SS
intend to
carrier.
get her
So,
pregnant? And
mm,
sorry, I have to mention this at this point. It's not a decision that people struggling with finances should make.
yeah.
If a guy is struggling with finances, you should be very careful making an SS woman pregnant,
True.
because how are you going to give her the best care?
I mean, if I'm just thinking about it, even from, let me say, layman's point of
Uh-huh.
view, you're already struggling with, having sickle cell. You
Mhm.
already have your crisis. Is going to have the crisis, your child is going to have struggling
Mm.
with. I don't think I agree with you on that point. I
Mm.
don't think it's a viable option to go for, trying to have an entire family
Mhm.
with sickle cell being sickle cell carriers, because
Mhm.
your health, your quality of life
Mhm.
is already drastically reduced at
So,
that
so
point,
I told them that I'm not against this kind of love,
Mm-hmm.
but if I were you, the guy was okay. The guys I saw, the guy was okay.
Mm-hmm.
Just the lady was SS. I said, well, it's okay. You can get pregnant doing surrogacy so that this woman can maintain a good status
Okay.
of health.
Yeah.
Going through all of this,
Mm.
but still, people don't just get it. Don't get it. They like the crisis, or rather, the choices just means they like the crisis. They like the crisis, and it's a very dicey one to deal with. But
Mm-hmm.
of course, at the end of the day, common sense and their own desires is what works. So if they
Yeah.
get pregnant, we have to stand by them,
And just help
give
them
them the
to.
care,
Mm-hmm.
support them to any extent.
Yeah.
Yeah, but then you have to make sure their blood level is fine, their
Mm.
emotions are under control, they are protected from malaria or any infection,
Mm-hmm.
and all of that until they get to deliver
Yeah.
the baby. And delivery should be by the best obstetrician,
Yeah.
or
Just
by the
as, yeah.
most senior obstetrician available in the center.
Mm,
You
okay.
know, so that's the problem with that.
I mean, you spoke about surrogacy, right?
Yeah.
That's another option, another reproductive option
Yes,
that,
for them,
yeah. So
for
what?
a lady who is
Mhm,
SS
mhm.
and wants to have, because yeah, I know there's a satisfaction having
Of
kids,
course, yeah.
very big satisfaction having
Hmm.
kids. So for a lady who is SS, can think about surrogacy
Hmm.
if they have the funds. If they have the funds, can think about surrogacy, because that's safe option to
Yeah.
go. At
Okay.
least there's no risk to you
Mm,
because of the burden of pregnancy.
yeah.
And pregnancy can be very tough
Yeah.
sometimes, even
True.
for
A
normal,
healthy
healthy
person. Yeah.
persons that have
Mm,
all the supports.
yeah.
Yeah.
But what other, reproductive options would you say are available for them to consider in case someone out there hasn't really thought about other options? Like we've spoken about surrogacy. Last time we mentioned, um, the couple that met with you and their faith wouldn't allow or wouldn't agree
Oh
with
yeah,
gamete donation.
yeah,
Things like that. Those other
yes. Okay,
options.
yeah. So now that was an AS couple.
Mm.
Now there are things they can do.
Mm-hmm.
Let's start from what is readily available.
Of
They
course.
can just decide to get pregnant spontaneously.
Yeah.
Spontaneously means they have intercourse and they just get pregnant.
Mm.
I know anytime they get pregnant, there's a 25% chance that the baby they're going to have will be a full blown sickle cell
Mm-hmm.
disease child.
Mm-hmm.
You know, full blown sickle cell disease child. And one or two things could be done here. By the time the pregnancy is 10 to 14 weeks, they could assess a center that has capacity to do intrauterine fetal genotype
Oh
testing.
yes, we spoke about
So
this.
that is what we, in the form of either chorionic villi sampling
Okay.
or amniocentesis. In this case, you take the amniotic fluid,
Mm-hmm.
as you have to poke a needle into the
Yeah, of
uterus,
course.
through the abdominal anterior abdominal wall,
Mm-hmm.
perforate the uterus, get into the amniotic space,
Wow.
and get some fluid out,
Yeah.
and do genotyping after doing a gene amplification,
Mm-hmm.
or go through the placenta to the cord and get a cord sample and do a genotype. Now, when you do a genotype, you see the genotype of the baby, whether it's AA, AS, or SS.
Yeah.
So at that point, the parent will have to decide what they want to do if the outcome is SS.
Mm-hmm.
But a good number of people doing this just with the intention of terminating the pregnancy.
Oh, okay.
Exactly. So now, for those whose religion doesn't permit them to do donor gametes, I don't know if the religion will also permit them to do a termination
Terminating,
of
yeah.
pregnancy. You know, you know, just what it is. So for those who are okay with that, then just go ahead to do that.
Mm.
But I have a big problem with that. I have a big problem with that. But
Yeah.
it's not about me; it's about them.
I mean, of course,
Hmm.
we're just here to
Yeah.
guide,
Yes.
basically.
Exactly. So this is an option.
Mm.
I've seen people who have done that, and the babies were okay babies, and so they're comfortable
Yeah.
going through the pregnancies and going to the point of delivery.
Okay.
So that's one option, or two options now: amniocentesis
Mm-hmm.
or chorionic villi sampling.
Mm-hmm.
Then there's also the option of doing non-invasive maternal testing.
Okay.
So instead of even going through the uterus now, you
Yeah.
can take the mother's blood sample
Mm.
and do a test to see the level of risks the baby is exposed to.
Oh,
We
okay.
call it
It's
non-invasive
interesting.
maternal
Yeah.
fetal testing. So when you do the test, it shows you in the form of risk, high risk,
Mm-hmm.
moderate, and low risk. So when it is high risk, it's chance that the baby is having abnormal genotype,
Mm.
thalassemia or sickle SS
Essence.
genotype, and so they could also decide when they. But if it is low risk, it means it's okay to go through the pregnancy.
Oh.
So that way you're not perforating the uterus,
Yeah, that's
going
kind
through
of
the uterus and
invasive.
all of that.
Yeah.
So these are the tests, these are the procedures available. So when you see the genotype of the baby, you decide what you want to do with the baby,
Mm. Okay. Okay.
and you decide what you want to do with the baby.
That's nice.
It's a very tough one.
It is
It's a tough
actually.
one, but
Mm-hmm.
people have to do what they have to do. Yeah, people have to do what they have to do.
Mm.
Then, of course, the best part to me is uh, IVF
Mm-hmm.
with pre-implantation genetic
Oh
diagnosis. Yeah,
yes.
this is pretty expensive.
Mm.
In this case, you get the eggs of the female
Mm-hmm.
and the sperm of her partner, and they make the babies. And after making the babies, you take a biopsy of each of the embryos and then do what we call the genetic testing.
Yeah.
And now, the beauty of the genetic testing is that it shows you a whole lot of other things about the baby than just the
Other than
genotype.
okay.
It
Yeah.
shows you the genotype of the baby,
Mm-hmm.
it shows you the degree of normalcy of the baby, it shows the presence of some genetic abnormalities,
Okay.
a trisomy 13, 21, just abnormal chromosomes.
Yeah.
So, in addition to selecting the healthy genotype that is desired, you also be able to select a baby free of abnormality,
Mm.
abnormalities, and you transfer or you implant in the woman,
Mm.
and then she has a chance of having a healthy pregnancy
Pregnancy.
without interference
Yeah.
if pregnancy occurs. So this is also available in this region. you know
Okay.
yeah, that is the things we have in our domain,
Yeah, that we can
that we
work
can
with.
we can work with.
Okay.
And but then this is expensive. I
Yes.
know what bothers me. I'm not talking as a scientist now, because when we sit in the consulting room, we talk like counselors.
Yeah.
Then a good number of people I see making these tough decisions are those I feel cannot afford any of this care.
That's
Exactly.
a really
You
tough
see a
position.
guy who is not doing anything reasonable. Apologies if any guy falls in that condition. We all were at that point at some point in time. You're not gainfully employed. You're not for a very endowed, well-to-do family.
Yeah.
You're not the high-class civil servant, and you're playing with costly love.
That's
Very
true.
expensive
Costly
love.
love. Yeah.
And then you hear that God will help it. Yeah, shut up. God doesn't help. You see trouble, you're going into trouble and saying that God is going
Oh,
to help.
oh wow. Okay, we might have a few offended viewers on that.
No, but no, I'm serious. I'm
No,
saying
but
this
yeah.
because I know that God has no business in this. This is all a product of chance. In the first place, God didn't create abnormal genotype.
Yeah.
It's an accident. You know, why I'm saying this is that most of these will end up having this trouble, and it ended up being our own trouble. Yes. So it's good to know that in the end of the day, you stand alone when this becomes a trouble.
Yeah.
So that's it.
I think above everything, I know it's love is a very strong emotion, and your faith is also a very strong value system for you, but you have people that have had these experiences and are totally informed about these decisions that you want to make, and that's why we're out here talking about this, giving you a more logical standpoint, because I mean, love is strong, but it's really not enough. You need to have that logic. You need to have a more, detailed thoughts about how your future is going to go, right? So above everything, I know that yes, for those of us that are religious and believe in God, we really do hope for miracles. But
And by the way, I believe in God so much.
yeah,
I'm a scientific Christian. I see God from a scientific
point of view,
point
yeah.
of view. And being in the reproductive field, it makes me appreciate what
Oh
creation
yeah,
really is.
yes.
And so I debunk myself of the misconception and the stupidity of the general public who always excuse everything on God. Exactly.
I mean, at
If a
this
child
point,
have sickle cell, they say it's
is
God.
God.
Forget it. It's not God. It's your choices. If you didn't marry the lady you married based on why you married her, you wouldn't have had sickle cell.
Yeah, true.
You understand? So it's just not God. It's just nature. An accident happened, and we fuel the probabilities,
Yeah.
and then we find ourselves in big
You probably
problems.
would think,
You
oh,
understand? So
maybe,
people should
yeah.
understand that this is just not God. God doesn't like bad things, and He doesn't do bad things.
Yeah.
So it's just emotions, for instance. There was a marriage situation that was going to happen some time ago, like 6 months ago. Our clients, they never knew they were sickle cell carriers. And so they have made posters of their marriage, invitation of the events, and all of that. And they now discovered they were sickle cell carriers, ASAS. They had to call up the marriage.
Oh.
Then there's another one I heard. I wasn't part of this. They called up the marriage, and one of the parents died.
Oh.
Yes, this is true.
Wow.
Yeah, for disappointment that they've invited the whole world, and you're calling up the marriage.
Oh, damn that.
They did the right in calling up the marriage, because how do you want to
Yeah.
put a little baby
True
in
that.
through that trouble? Should you have an genotype
Yeah.
baby? So this is, everybody needs to be wise for himself, and that is why you see churches are those who have who propagate God a lot. Churches don't even agree for you to do that. Yes, A lot of traditional churches don't permit you
Oh,
to
that's
go into a
interesting.
marriage if you are AS and AS.
Yeah, actually.
I don't support that. I feel you should give them counsel and let them understand and make their
Mm-hmm,
decisions.
mm-hmm.
So give them all the options,
Yeah.
but
I
in
mean,
the end,
I mean it's a very interesting topic and
yeah.
all that.
So I love God and I believe so much in God, but I
Hmm.
understand God from the creation perspective, from
Perspective.
reproductive
Yeah.
perspective. And I know that most of the things you see is just not God.
Yeah. Okay.
Yeah.
Well, we have another question that just came in for us while we're here. Asking if it's okay to do sperm donations for someone who is a sickle cell carrier. I mean,
Oh,
does
yeah.
it affect?
Yes, of course. That's one of the options.
Mm,
Yes, and that's a very good options.
yeah.
You know, the couples could either have a sperm donation
Mm-hmm.
or egg donation. It's a cheaper option of treatment actually. But in this case, you
Then
know that somebody is sacrificing his gamete.
yeah.
Sacrificing the gamete, so you just make a healthy baby.
Mm,
It's a very good option.
okay.
But
Okay.
then if you're doing that, if it's a sperm donation, you may have to be doing an intrauterine insemination if the lady is okay.
Mm-hmm.
Fallopian tubes are fine, she's ovulating, the uterine lining is okay, she could do insemination
Yeah.
or IVF. But
Yeah.
if it is egg donation, it has to be IVF,
Of course. Yeah.
because there's no way to
There's
work
no
with the
other
egg. It
way.
has to
Yeah.
be an IVF.
Mm,
So these are very interesting ways of navigating um, this abnormal combination of
yeah.
genes, genotype. Yeah.
Okay. So we've spoken a lot about,
Then of
fertility
course, if they have
prospects.
a full blown baby already,
Yeah.
then it's CRISPR they were looking at.
Of course, I was, I was getting to
CRISPR.
that. We've spoken quite a lot about fertility prospects and other options that are available for you. I mean, I'm not encouraging that, because of these options available, you should go ahead and you know not take that genetic
Hmm.
counseling into play, but just so that you have more information and you have more knowledge in your armory about the decisions that you're about to make. But we had more questions about CRISPR, everybody's favorite topic apparently. um People want to know, is CRISPR a medical procedure? Is it medication, I mean, or is it a surgical procedure?
So it's a procedure. I'll call it a procedure
Mm-hmm.
for now. I call it a procedure with what we have right now. So this is how it does. The stem cells of the individual is taken from him,
Yeah.
and then it is edited outside, just like taking your blood sample,
Mm-hmm.
and then it's treated with CRISPR,
Mm-hmm.
edited outside, cultured outside under the treatment of CRISPR,
Yeah.
and then it is put back inside you.
Mm-hmm.
That's what it does.
Okay.
So now, there's a lot possibility with CRISPR. When you edit a gene, for instance, you can make the gene to be a selfish gene. So when a gene is selfish, it means it perpetuates itself and
Mm-hmm.
it transcends generation. So
Mm-hmm.
there's just so many things you can think about with CRISPR.
Yeah.
It perpetuates itself, and wherever it sees itself, it becomes dominant.
Mm-hmm.
And then it's selfish. It constantly manifests
Mm-hmm.
wherever it is.
Oh, so you can
So
make a more dominant gene over
exactly,
generations. Oh,
exactly.
interesting.
So for instance, if you change a character in an individual,
Mm.
you can make the character a selfish character. For instance, you make a woman have make a woman have blue eyes.
Mm-hmm.
You could make the gene for that blue eyes to be selfish genes.
Okay.
So even if she decides to have kids with somebody with black eyes, like us, black
Mine are brown,
eyeball,
please.
mine is black. So the blue manifests.
Mm-hmm.
So life is just like an open system. You could
Yeah,
just
when you have
actually
CRISPR.
manipulate it the way you want to do, and
Mm-hmm.
that's the beauty that CRISPR brings in here.
Yeah.
So with CRISPR, you get the stems. You create stem cells of an individual from his cells,
Mm-hmm.
and then you treat with CRISPR and edit the genes of those cells. Then
Okay.
you infuse the stem cells back in the individual. So some kind of procedure is involved.
Mm.
Infuse the cell back in the individual, and then the cells takes over the system, and now begin to grow healthy blood in the system.
Okay.
Yeah,
Oh, that's
and so that is how
interesting.
it works. So
Yeah.
it's not like a tablet that you ingest.
Mm.
It's not. It's a procedure. But I get a feeling that we're going to get to a point where you could target some specific genetic characters using CRISPR substance in the form of tablets.
Oh my God.
Exactly. It just goes
That's
to where you want it to work and it acts. So
oh
there's just so much with CRISPR. We can't talk about it now,
yeah.
and there are some characters that can still be in you, but they'll be deactivated.
Okay.
If you deactivate the genes, they'll
Interesting.
be there, but they will never be transferred
Hmm.
to some other persons.
Hmm.
And even in you, they will not express themselves.
Okay.
So these
Okay.
are all
So it
possibilities
is a
with
CRISPR.
CRISPR. And aside the sickle cell, we're talking about all the genetic
Hmm.
abnormalities, yeah, can be treated
Okay.
using CRISPR.
Well,
So
that's
that's one of the
interesting.
options of
Yeah.
treatment
Mm-hmm.
using CRISPR. Oh
Okay.
yeah.
Yeah, I mean, we did talk a lot about CRISPR in the
Mm.
last session. And, today we really had to focus more on fertility because you had a lot of questions on that. And thank you so much, Dr. Ken, for answering all our questions. You brought new insights on these things. So, thank you for joining us. Thank you for sticking with us again. We really do apologize for the delay in broadcasting, and we appreciate you staying until the end of this. We hope you've gotten more information. You're more knowledgeable about the decisions that you're going to be making from now henceforth. Thank you for joining us. We'll see you next time. As I always say, join us on all our social media platforms. Okay, we're everywhere. We're basically the Gen Z hospital. We're on Instagram, we're on TikTok, we're on Facebook, and we're on YouTube. So you can join us Wednesdays and Fridays by 3 p.m. for our live shows. Turn on your post notifications so in case you forget, your phone reminds you about that. All right, then, everyone, have a lovely day. We'll see you next time. Bye.